In today's Daily Health, a new study finds more young people are choosing permanent contraception since the Supreme Court decision to overturn Roe v. Wade.
According to the Journal of the American Medical Association, there has been an increase in vasectomies and tubal ligations, sometimes called getting your tubes tied, in young people between the ages of 18 and 30. Joining us now to talk about it is NBC News medical contributor Dr. John Torres. Dr. John, this got our attention for sure. Is it surprising to you as a doctor that more young people are choosing this method of contraception, which is sort of a final method?
You know, if you see the headlines, you're surprised, but then when you start thinking about it, you're not entirely surprised. And the main point is we can't directly say one caused the other, that the Dobbs decision caused these increases in sterilizations. But looking at it time-wise, and this is the way the University of Pittsburgh School of Public Health did their study, is they actually went and they said, let's look before Dobbs and let's look after Dobbs. After Dobbs, they found that increased rate for men and women in permanent sterilizations. And so that, again, probably not a huge surprise because of the abortion restrictions that are going on around the country and the difficulty they're having. And I think there's a bit of a scare factor there, too, that they're worried about what is going to happen going forward, and so they want to take care of it permanently.
And I'll say, pre and post-Dobbs, I've heard my friends talk about this, a young group. And the question that comes to my mind is, how young is too young to do some of these procedures? And are there any sort of long-term consequences people should be aware of?
You know, it is a permanent sterilization procedure, both of them, both the tubal ligation for women and the vasectomy for men. You have to think of it as permanent because there are some instances where it's reversible, but the surgeries are not that uncomplicated. And so, again, you think of it as permanent. What the study looked at, and it's interesting, if you look at other studies, even before Dobbs, 30 years old seems to be the line, the delineator, the line there. Below 30, in this group, they looked at 18 to 30-year-olds that are having these increased rates. Below 30, they tend to get the sterilization regret later in life, where they say, you know, maybe I shouldn't have done it. Maybe I want to reverse it because I met somebody now. I want to have a family, whatever. Above 30, they don't tend to have that as much. And it's actually a pretty dramatic fall off at that point. And so the answer to your question is that's probably the biggest thing, is that sterilization regret. Is that going to happen 10, 15 years from now?
And to be clear, isn't it more reversible in men? Like, yes. I mean, that's what I've always thought.
Well,
vasectomy is reversible, but for women, it's not really.
The surgery in general is, in women, it's a bigger surgery. It's a major surgery. In men, it's a less complicated surgery. Reversibility for women, to reverse it, 50 to 80% success rate. They're leaning kind of towards that 50%. For men, it's 80% success rate in reversal. And so, you know, the things you want to think about, you can see it right there. Going in on this procedure itself, you definitely need to talk to your doctor about this and say, you know, what are the risks versus the benefits? Is it reversible? There are some what they call long-acting reversible contraceptives, IUD being the biggest one, that we can, after, you know, 10 years or so, exchange it for another one.
Yeah, and non-surgical.
Non-surgical, they're reversible.
Right.
And so you just want to make sure you understand going in with your eyes open what exactly is going to happen and what it means long-term.
And then briefly, beyond contraception, I'm thinking specifically of women. There are other reasons people get some of these procedures. Specifically, I'm thinking of a hysterectomy.
There are other reasons, getting hysterectomy, getting other procedures. The tubal ligation has been shown to reduce ovarian cancer, so if there's a big family history, sometimes they'll do that as well. Sometimes they have other health issues and they want to make sure they don't get pregnant because it could complicate their health issues. So there are other reasons as well.
Yeah, and we don't know from the numbers that we're getting what's driving each of those individuals to seek this out.
Exactly.
Right?
And like I said, they're looking at it from a timeline point of view, but not a necessarily reason point of view.
And just lastly, what complications can there be with these procedures?
So with complications, again, the vasectomy isn't as complicated as the tubal ligations. For the vasectomy, you think of it with any surgery, you're going to have surgical complications. You're going to have bleeding, possibility of blood clots, swelling at the site. In this case, you know, for the vasectomy, the swelling there of the scrotum in that area, infections and mild pain or discomfort. For women, on the other hand, with the tubal ligation, it's much more complicated, and they could have scarring. They could have much more long-term issues with bladder and bowel.
Yeah.
So, again, one of those things you have to be concerned with.
A lot to consider. Dr. John Torres, thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.
As America navigates a post-Roe v. Wade world, a staggering number of women are now considering permanent sterilization procedures. Following the Supreme Court decision, Google searches for procedures like tube tying or tubal ligation surged as much as 200%. I traveled to Austin, Texas, where I spoke with 3 women about how the latest abortion restrictions affected their decision.
Here at Women's Health Domain, a clinic in Austin, Texas.
Good morning, thank you for calling.
Dr. Tyler Handcock says his team has been fielding more calls than ever.
They're asking for permanent sterilization.
So permanent sterilization, tubes removed?
Yes.
All since the Supreme Court overturned Roe v. Wade, ending the nationwide right to abortion.
They want something permanent because they fear that tomorrow there'll be no other option.
How many were calling before versus after that Supreme Court decision?
1 to 2 a week would be average. The weekend following, there were 200 messages by Sunday night.
Since this is an afternoon.
In fact, he says he's received so many requests asking for permanent sterilization that he and the practice's co-owner, Dr. Amy Chapman, hold weekly group information sessions.
I mean, how many people are in this room?
A little over 20 at a time.
Per session?
Per session. How are you today? Good, how are you?
A decision 27-year-old Brooklyn McNair, who's pregnant with her 4th child, says she's planning to make soon, influenced by the Supreme Court ruling.
I don't want any more. I'll be 27 in October, and I'm just done.
You're done?
I'm done.
So are you for sure that sterilization is something that you want to do or just something you want to learn more about?
I think it's something for sure I want to do.
And she's not alone. Google searches for sterilization procedures surged by as much as 200% after the Supreme Court decision. And membership in some Facebook support groups for women seeking the procedures has nearly doubled, with one group growing by 2,500 members since the ruling came down.
Being able
Groups Megan Salon and Ashley Ball both joined.
So, Megan, you already had your tubes removed.
Yes.
And Ashley, you're about to begin the procedure?
Yeah, I'm in the process of consultations.
What was behind the timing of when you decided to have this procedure?
After the draft decision was leaked, I decided to schedule the procedure sooner than I had originally anticipated.
What was it about that leak that made you say, I'm going to do something for myself now?
Well, I've always known I didn't want children, and I didn't want to be in a position where I didn't want children and would lack access to contraception as well.
So, like Megan, I have always known that I didn't want kids, and when we started seeing more of the restrictions coming through, that's when I scheduled my first consultation appointment.
They say others like them are often dismissed by doctors who are reluctant to perform the procedure.
You're told that you are too young to make this decision, or what if your significant other wants children someday?
What if you change your mind?
What if you change your mind? What if you regret this someday?
Let's be honest, there's a lot of judgment around the decision to have this procedure, around this decision in general.
Right.
What do you say to people who don't understand?
Sterilization or permanent contraception is just as permanent as choosing to have a child, right? So a lot of the arguments against it, like, well, what if you regret it? You could say the same thing about having a kid.
It's a choice they expect to see even more women making in the days ahead.
Nobody wants to be put in a situation where they have to make a choice between, the medical health of whoever is having that kid and the kid itself. So a lot of people are just saying, okay, we're not going to. We're going to go for sterilization instead.
And just to be clear, it's not just women. Daily searches for vasectomy clinics increased to an all-time high of 110% after the Supreme Court decision came down. The most popular searches for both forms of sterilization, so we're talking about tubal ligation and vasectomy, were in states like Ohio, Missouri, Indiana, all places with current or likely bans on abortion.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.
With Roe v. Wade now overturned, more Texas women are opting to have their tubes tied. Some OBGYN offices are being flooded with requests for that procedure. Doctors say a tubal ligation does not affect your hormones and it decreases the risk for ovarian cancer, but it will not protect from sexually transmitted diseases. And in rare cases, women could experience ectopic pregnancies. Melissa Correa explains the high demand for women wanting to prevent pregnancies with a more permanent form of birth control.
Dr. Sherry Levin is seeing such a surge in patients.
Oh my gosh, our phones are ringing off the hook.
The only time we could fully respect their privacy is during the doctor's lunch hour.
This feels in our patients' minds emergent.
In the week since the Supreme Court reversed Roe v. Wade, Houston OBGYNs are reporting more women wanting to become sterilized by having their fallopian tubes removed.
They're scared. All it takes is, it's my birthday and I had sex with my husband and his condom failed. My birth control pill failed. So yeah, it feels like an emergency to them. They're like, how soon can you do it?
Or they're wanting long-term birth control, like an IUD, which is implanted into a woman's uterus.
If we don't want to be pregnant, we should be using birth control. But it's a different sense now for people. They just realize their choice is gone.
And high-risk patients realize the legal consequences doctors now face. State law allows citizens to sue doctors suspected of providing abortion procedures, which are also used when a woman miscarries. Some Texas pharmacies now refusing to fill prescriptions for methotrexate, a medication that helps a woman with an ectopic pregnancy. That's when an egg fertilizes outside of the uterus with no way for the egg to develop.
Yeah, it's really sad, isn't it?
One of Dr. Levin's patients wants to conceive through IVF.
She called and asked, will I take care of her? Because if it comes down to her health or her baby's health, I can be in a pickle. But you still got to do the right thing, and you still have to take care of patients. You just do.
Again, that was Melissa Correa reporting. Thousands of doctors across the state are now calling on the Texas Medical Board and politicians to consider all these unintended consequences connected to anti-abortion laws.
But new tonight, the reversal of Roe versus Wade is leading some Texas women to opt for a more permanent form of birth control.
They are having their tubes tied since the Supreme Court decision. We're learning some OBGYN offices are being flooded with requests for the procedure. Doctors say a tubal ligation does not affect your hormones and decreases the risk for ovarian cancer, but it will not protect from sexually transmitted diseases. And in rare cases, women could experience ectopic pregnancies. Melissa Correa here now to detail the high demand for women wanting to prevent pregnancies this way.
Dr. Sherry Levin is seeing such a surge in patients.
Oh my gosh, our phones are ringing off the hook.
The only time we could fully respect their privacy is during the doctor's lunch hour.
This feels in our patients' minds emergent.
In the week since the Supreme Court reversed Roe v. Wade, Houston OBGYNs are reporting more women wanting to become sterilized by having their fallopian tubes removed.
They're scared. All it takes is, it's my birthday and I had sex with my husband and his condom failed. My birth control pill failed. So yeah, it feels like an emergency to them. They're like, how soon can you do it?
Or they're wanting long-term birth control, like an IUD, which is implanted into a woman's uterus.
If we don't want to be pregnant, we should be using birth control. But it's a different sense now for people. They just realize their choice is gone.
And high-risk patients realize the legal consequences doctors now face. State law allows citizens to sue doctors suspected of providing abortion procedures, which are also used when a woman miscarries. Some Texas pharmacies now refusing to fill prescriptions for methotrexate, a medication that helps a woman with an ectopic pregnancy. That's when an egg fertilizes outside of the uterus with no way for the egg to develop.
Yeah, it's really sad, isn't it?
One of Dr. Levin's patients wants to conceive through IVF.
She called and asked, will I take care of her? Because if it comes down to her health or her baby's health, I can be in a pickle. But you still got to do the right thing, and you still have to take care of patients. You just do.
Thousands of doctors across the state are now calling on the Texas Medical Board and politicians to consider all of these unintended consequences now connected to these anti-abortion laws. The flip side of this story is what we reported last week. More men are now scheduling vasectomies. You can watch that story once more online at KHOU.com right now, Len.
All right, Mel, thank you. Today, Galveston.
With Dr. Marianne Bowman. A viewer wants to know if it is possible to get pregnant after having her tubes tied.
Tubal ligation is considered a permanent form of sterilization. Now that I said that, I will tell you there is about a 1 in 1,000 chance of getting pregnant after you've had a tubal ligation. Somehow that egg finds a way into an opening in that tube and can get down and be fertilized. So it is about a 1 in 1,000 chance of getting pregnant after a tubal ligation. Now, if you're talking about a reversal, yes, a tubal ligation can be reversed and the person can get pregnant after that. There is a higher incidence of tubal pregnancy because of the scars that are in that tube. It is possible that the egg gets caught there and you have a tubal pregnancy, and of course that can't be sustained and the pregnancy will not continue and the person generally needs surgery. But if you're just talking about can you get pregnant after the tubal ligation, about a 1 in 1,000 chance.
And if you have a question for Dr. Bowman, call the hotline at 841-9999 or send an email, drbowman@news9.net.
Well, he plays a huge role. All right, folks, I'm back now with Dr. Jen talking about a new study that's taking a look at how the monthly rate of young adults getting their tubes tied and vasectomies increased immediately after the Dobbs Supreme Court decision.
Yep,
What do we know?
We're coming up on almost 2 years after that decision, June 2022. And so now there's a recent study published in JAMA Health Forum that tracked what we call surgical sterilization procedures. So that's bilateral tubal ligation, tying, cutting, removing the fallopian tubes in women, vasectomies in men, dramatically up, not really a surprise amongst young people. So we're talking about even people in their 20s and early 30s after that decision. BTL tubal ligation rates continue to go up. Vasectomy rates are kind of stabilizing. But I think when you hear this, the big picture, I think, is an awareness of options and just how people are feeling about taking their reproductive health into their own hands, not feeling this sense of helplessness with what's going on legally, politically, and in the government based on the states in which they live. And I have to say, the vasectomy rate increase I found really interesting. This is such a misunderstood procedure for men. So many men afraid of it. It is literally a 10-minute in-office procedure with minimal to no discomfort, ice packs for 48 hours and Tylenol, and for women, removing the fallopian tubes or cutting them dramatically lowers the risk of ovarian cancer. So I think this is just an opportunity to talk about the contraceptive benefits and non-contraceptive benefits as a result of something we saw politically.
I heard a guy talking about they were doing the vasectomies around March Madness. So they could watch March Madness on
Very
their donuts
popular
with the
time.
ice.
There you go.
Sounds like a good time to be together.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.
A lot of women want to know what to expect after having a postpartum tubal ligation, otherwise known as getting your tubes tied. They're not sure if they're going to have periods or not, so this is a really good question. When your tubes are tied, it doesn't affect your hormone levels, so you will continue to have periods because you still have your ovaries, you still have your uterus, and so you'll still have regular cycles. If the bleeding patterns that you've been having after a postpartum tubal ligation are unusual or concerning to you, talk with your doctor. For example, if your periods have become irregular and you've gone 3 months or more without a period, if you're having abnormally long periods, or they're heavy, or you're having spotting in between periods, then all of those things should be reported to your doctor. And after asking you more specific questions, they'll be able to decide if anything else needs to be addressed. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.
I don't want any children. I've never wanted kids, even when I was a young little girl. And she's always said, oh, wait. And then last year I went up and I asked her, and she blatantly told me, oh, what if you meet the man of your dreams and he wants kids? There's no safety reasons. It's just her personal opinion.
That's Victoria Mirsky. She says for nearly a decade, she's been trying to get a tubal ligation. That's a permanent procedure that would prevent her from ever having children. But at 29, she feels she's been dismissed by doctors who say she's too young and she'll live to regret it. Now, according to Canadian guidelines, they were changed in 2016 to say that age or the existing number of children a woman has should not be a determining factor as to whether or not to perform the procedure. But one OBGYN who was actually involved with changing those guidelines says that hasn't stopped Canadian doctors from denying that young women from getting that procedure.
Most physicians who are refusing are doing so with a good intention. I think it's what I call a well-intentioned paternalism. It's not intentionally meant to be harmful. It's that doctors feel that they are reducing the risk to women who may go on to regret their decision. So I think it's important for the doctor to explain clearly why they feel that this shouldn't be offered to this specific woman, that they should be letting the woman know that the reason they're declining is because of their own personal decision and not because it's it's not medically sound. And then they should be offering those women an effective referral, which means a referral to someone that they know will be able to provide it.
Some studies have shown that about 4% of women go on to regret tying their tubes, and that number can go up to 20% for women under 30. But Dr. Costescu points out that the rate of regret is actually higher for women who already have kids before tying their tubes than the women who don't.
The reason for that probably is that women who want child-free living don't change their minds. What happens is people who have 1 or 2 children may decide later they would like to have more. And so, again, people might think that they're causing harm if doing a tubal in a woman with no children. In fact, those women are at lower risk of regret.
Now, about 10% of Canadian women use tubal ligation as their method of birth control. Now, some studies have suggested that women under 30 who get it may become at higher risk for needing a hysterectomy later in life. But other studies have also suggested that it might actually offer a slight protection against ovarian cancer and pelvic inflammatory disease.